Well, I think we've got a group quorum here, waiting for the start of this wonderful breakout on high resolution population data, putting vulnerable communities on the map. And welcome to this wonderful breakout. And it's my pleasure to pass it over to Peter Hynes from World Vision US.
Great. Well, good morning, good afternoon, everyone, from wherever you're calling in from. We're excited to have the three of us from World Vision here today. Maybin, Leonce, and I work very closely together, but we're sitting in three different countries at the moment. So I'll give them a chance to introduce themselves in just a second. My name is Peter Hynes. I'm a senior manager for WASH programs at World Vision US, based out of the Boston area for now, and have worked really closely with East Africa over my career at World Vision. Now I've been at World Vision almost 10 years, just over 9 years. So Maybin, over to you.
Yeah, thank you so much, Peter. Good morning, good afternoon, everyone. My name is Maybin Ngambi. I'm the Regional Programs Director for East Africa region, leading the WASH program in 9 countries. And I've been with World Vision for over a little bit, 14 years now, managing WASH programs. Thank you so much, Peter.
Great. And Leonce, over to you.
Thank you very much, Peter. Good morning, good evening, everyone. My name is Marie Leonce Murebwaire. I'm the Health and WASH Technical Program Manager at World Vision Rwanda, and I've been working in World Vision for the last 2 years now. Yeah, thank you so much. I'm happy to be with you this evening to talk about WASH in communities.
Yes, and you just traveled to Nairobi, so you're based out of Nairobi just for the week this week. So that's why we're calling from US, Rwanda, and Kenya all together this week. Perfect. Well, we're hoping to have a pretty good discussion here with everyone. I'll start just by talking a little bit about World Vision and our approach to data, and then we'll get into a specific example of a Rwanda project, and then have a bit of a discussion amongst the three of us, and then we'd love to open it up for all of your questions. So please don't be shy. Put things in the chat, raise your hand, anything. We'd love to make this as interactive and robust as possible. So World Vision is a multi-sector NGO. I think there's about 30,000 of us across the globe, based in different offices. And so I sit at the World Vision US Support Office. Maybin is at the East Africa Regional Office. Leonce has been at the Rwanda National Office. So we're all one big umbrella of World Vision, but lots of different organizations inside of that. And sometimes, the strength and sometimes the weakness, but usually a strength of World Vision is that we are so multi-sectoral. So, the three of us here on this call focus very specifically on WASH. And sometimes we think if we were an organization that was a WASH only organization, some things might be easier. But the fact that we have education programs and health programs and livelihoods programs that we can talk to our colleagues who sit in the office next to us and think through programming, I think makes the impact that we do stronger. And so even though it may take a little bit longer to get everybody on the same page and get people to co-create programs, I do think deep down it is a strength of what we have. So in terms of data, since we're really thinking about, how are we validating, what are we doing, how are we using spatial data today? We've been on a course over the last 15 years at World Vision WASH, maybe even 20 years, around how do we do better standardization of our data, visualization of our data. And so really basically one of the things we did back in 2010, 2011 is that we really standardized our indicators across all of our projects. And so originally in 2010, we had 10 different countries doing WASH programming. That has now expanded today to 42 different countries doing WASH specific programming. But all of those countries have to use the same standard indicators to report against. So we can not only get a national level view, but a global level view of all of the data. And spend a lot of time training everyone on what do the SDG indicators mean? What does it mean if we have basic water access, limited water access, all of that. So one of the things that has resulted in is we do have, I'll just share my screen here for a minute. We do have this dashboard here. And so since we've standardized all of our indicators, traditionally we have asked people to put information into an Excel-based ITT, and now we pull all of those Excels together in a Power BI dashboard. So if you go to worldvision.org/water impact, that's worldvision.org/water impact, it should bring you to this page. And if you click on the overview start here button, this actually gives you historical data for all of our World Vision WASH programming since 2016 here for the data that we have. So we can see just this past year in 2024, we reached just over 3.1 million people with water, 2.4 with sanitation, and 2.8 with hygiene. If we want to get more specific, we can zero that into just East Africa, since we'll be talking about Rwanda here in a second. So we update just to the East Africa region, and we can even dive down a little bit more to look at just Rwanda. So this has been really helpful for us as we have everyone kind of looking at the same data at the leadership level, at the support office level, has been really helpful for us. But this Power BI data pull has been based off of Excel-based ITTs. So it has not necessarily been as place-based and tied to GPS as we would hope. And so what we've been moving to over the last 3 or 4 years, I would say, is the mWater application. So mWater is a specific digital application made for WASH practitioners where you can collect data on different sites like a water point or a school and a healthcare facility, and then collect survey data for those indicators that we normally were collecting by hand, paper and pencil, or an ODK or something else. Now we're centralizing it all in mWater. So what I'm showing right now is our public mWater hub. This is worldvision.mwater.co. Everyone should publicly have access to at least this first page here. And you can drill down into, our specific areas of where we have water points that we've mapped as part of our work. So as we continue to drill down into individual areas here, we can see where work has happened over the past few years. I would say the data in this system is really 2023 and beyond. We're getting better and better at collecting our data in a digital format. But what's really nice about the mWater platform is that now, instead of having a national level representation of what we've done in Rwanda, let's say, we can look at very specific areas within Rwanda and see, okay, what water points have been created or built and constructed. And we can share that information with government. So governments or partners can also have a view in mWater. mWater is a public platform once you have a login, which is free to create. And so you can look at any water point, water system that's been created. It's our hope that we can do a lot more handover of data to government, that once World Vision creates a water system, we map it fully in mWater, and then that can be used by government for tracking of that system. You can go in and do functionality surveys of water points. And mWater actually is working on some financial applications as well. So how could you track user fees that are coming into a water system? All of that can happen in mWater. So one of the things that I really like, I've heard one of our colleagues say, is that as an organization, we really shouldn't be thinking of our work as sector siloed work. We should be thinking about it as a place-based work, right? That in this location, it's not just water projects that are happening, but it is livelihoods activities, it's kids going to school, it's kids working or people working in healthcare facilities. And so this application is a way for us to better be able to see that on a map, think through who else is working in this area, what other partners are here, and go from there. So before I share just a few slides on the Rwanda specific project, maybe Maybin, I'll kick it over to you really quickly. How have you seen So Maybin actually used to be our Zambia WASH manager and is now our East Africa regional leader. So he has both a country-specific view and a regional view. How, Maybin, have you seen that kind of transition to more digital tracking? It's been challenging, but what have the pros and cons been to you?
Yeah, I think as you've mentioned that it's been challenging because we had a lot of data which was not really, it was a little bit challenging with the data that we have because validation was not being done in some of the data that we had. And also the system that we are using, like the World Vision system, the Horizon, didn't give us a lot of room for us to be able to be flexible and make adjustments to the data and what have you. But I think what has been critical in terms of how we've tried to move and migrate some of that particular data is that at least we had a little bit of that information that we're able to migrate it to M-Water portal, which I think has helped us to look at prioritizing data-driven monitoring and also in terms of decision-making, I think which has been very, very important in terms of universal service coverage for both water supply, sanitation, and also hygiene, because now we're able to know that this data is being validated. This data, we're able to locate even where these particular water points are located. So if you go in the field, for example, you've got your M-Water on your mobile phone, you are able to look at that particular water point, the functionality, and all the status in terms of how many people are accessing that particular water point. So this has at least made our work very easy in terms of even decision-making, even our donors in terms of being able to connect with the investment where it is located in each of the countries where we are operating as World Vision, including Rwanda, where we've been able to reach universal service coverage in about 39 subsectors, sub-districts.
Great. And I will say, we're still working out challenges and kinks here. So if anyone has thoughts or ideas, would love to hear them. It definitely is easier to track and map community water points and water systems. A continual question that we have is around the manpower to collect data around household connections or household level sanitation and hygiene, and also the data protections around those needs if you're at a household level. So Leonce, you are in the national office, going out, collecting some of this data, training people to collect this data. What would you say are the cost-benefit analysis here, right? Like what was really challenging? What made things easier? How have you viewed that transition from the personnel side?
Thank you so much, Peter. So I think M-Water being able to be used offline and on mobile phone was really easy for anyone to be able to collect data in your time and also upload them in on the platform. So this, I would say it has not been really difficult to implement. But I think what has been challenging was to move data that was collected previously to the new platform. Otherwise, our partners, our volunteers were happy and to support in collecting data with their phone and without needing internet necessary to collect and map all the water points. Yeah.
Great. So we did want to get into a specific project example to talk more about how we use some of this spatial analysis data to help our decision making and also working with government and partners. Leonce, before I dive into those just couple slides, did you want to give a high-level overview of the project in Rwanda, just since you were the one leading it there?
Thank you so much. Happy to do so. So in a nutshell, this project was to increase basic access in the 39 sub-district, as Maybin said, where World Vision was operating in 2018. So the project had a timeline of 5 years from 2018 to 2023 to reach basically everyone at that 100 coverage with basic access to water. That is having access to a clean water point within 500 meters from your home or 30 minutes round trip. So at that moment, the population that needed basic water access in those 39 sectors was approximately 1 million. And it started with, first of all, developing our goals, and it was fortunate that our goals were aligned with the government strategy of reaching 100 coverage of basic access by 2024 this year. So it was very easy to partner with the government in implementing that project. So World Vision and in some of the government institutions have put efforts together to also implement this project. And the cornerstone of this project has been the MOU that has been signed between World Vision and the line ministries of the wash sector, that's being the Ministry of Finance, the local government, and the Ministry of Infrastructure, and also the Water and Sanitation Utility. So this agreement actually has been very important because it allowed districts to contribute 40% of the water project, while World Vision was contributing the remaining 60%. So it also helped us to benefit from the technical support from the Water and Sanitation Utility, which was really and is still very important during water project implementation and also operation and maintenance after construction. So another component of the project was the community engagement, because their opinion and commitment to support the project is very important to ensure ownership and sustainability of the project. So we have really learned a lot during this journey, and I would say that without the partnership, the joint action with government and also other stakeholders in the sector, it wouldn't have been possible to reach over 1 million people within a period of 5 years, sorry. So yeah, that's it. So partnership is key to such projects. Thank you so much.
Great. And we'll definitely come back around to those key partnerships in a minute, because like you say, both the government partnership and local partnerships is key to everything that we do. So I'll share my screen again here just really briefly. I think I've got about 5 slides here just to bring home the project as Leonce has described it. So what our approach was really water in households, schools, and healthcare facilities. We did push for sanitation and hygiene, especially in facilities and schools and healthcare facilities, and built some of those directly. And then on the household side, we did work more on the behavior change side, subsidize the poorest households to build latrines. But really the cost to build household latrines is not something that World Vision typically does. It's more of a household need. And so we think through financing, helping get people financing and pushing through behavior change and those kinds of things. We also had key trainings for private operators, who are the ones who would operate water systems in the long term after World Vision handed them over to the government, as well as local artisans who might help households build latrines, and then school committees and faith leaders for really the long-term sustainability of the work. So thinking through what will this look like 10 years from now, and how do we ensure that infrastructure is taken care of appropriately? So I would say the key ingredients for success here, as Leonce did mention, is the high-level engagement that luckily in Rwanda, there's a very strong push to reach universal water coverage. And so we just aligned our work in the 39 sub-districts where we already had programming and said, we will help you do it in these 39 specific areas. And so our plans were aligned really strongly with the government. And then we worked on the local empowerment side. And so, World Vision, as I mentioned before, and as evidenced here by the panel, World Vision is this big umbrella organization, and there's lots of different peoples and lots of different offices pushing for priorities. We really let World Vision Rwanda take the lead here and say, what's the strategy you want to take and how can we support you in reaching universal coverage? Our goal is universal coverage of water. So how do we do that best? You tell us. And then also the Rwanda team worked really closely with each of the districts. I think there were 15 districts that represented the 39 different sectors, the sub-districts, for putting money towards those systems. So as Leonce said, the government gave 40%, World Vision gave 60%. We wouldn't have been able to do nearly the number of systems we did if there wasn't that level of investment from district governments. And then we were able to prove what we actually did through data. And so we really took a 3-step approach to proving that we had hit universal service coverage. One was just talking with the government and agreeing that, yes, we've done all the work that we said we would do and we've reached this whole sub-district. So that was with a sign off from the government that we did reach our goals. The second was mapping. So as we saw in MWater, we would map all of the water points that were constructed and put a 500-meter buffer around each water point. So thinking that if you live within 500 meters of a water point, it's relatively reasonable to assume that within 30 minutes you could get there and back, which is the definition for basic. So then by overlaying population data, anybody who lives within that circle, we can say is reached. Anyone outside those circles, we would say is not yet reached with basic access. So by mapping all of our water points, we were able to see when we reached 90% or over. And then our third step, just to be sure that we actually had done what we said we were going to do and that all of the water points were functioning, was a household survey. So we surveyed about 100 people, 100 households in the area once we thought we were done, asked them about their water source, walked with them to their water source to make sure that indeed the systems were operational and they were accessing water from the appropriate location. So what we actually did, what we achieved. So the project lasted 5 years, as Leonce said, fiscal year 19, so basically 2019 through 2023, and we were able to reach almost 1.2 million people. And so I think sometimes when we're in it and doing the work all the time, we don't pause to reflect on the achievements that we've reached, but 1.2 million people with water access that did not have it within 30-minute round trip before is a huge achievement that the Rwanda team, the government, everyone should be celebrating. And then you'll see the information there about sanitation. Hygiene was a lot higher. Hand washing was a lot higher because you'll notice this overlapped COVID. So there was a big push during the COVID years for more hand washing facilities. So that's why that number is a little bit higher than the others. And then 81 health facilities, 317 schools, and 94 total water systems constructed. So at the very end of everything, we did have Emory come in and just say, hey, can you tell us, how this went, do some research to help us think through how we might do this better in the future. So they actually ended up interviewing about 50 of our World Vision Rwanda staff, government staff, people who worked with the private operators. And the key things that came out of that is partnership with the government, consultation with the community, and that clearly water has its own benefits, right? Like people can clearly see the benefits of the project, were the 3 major strengths, which I think some sectors don't have the luxury of the clear benefit like water and sanitation does, but I think everyone can take away the partnership with the government and the community consultation as key areas that we should all try to emulate in our programming. And then we're always looking to improve here. So some recommendations for Emory. Again, if others on the call have recommendations, would love to hear them here in a few minutes. But just more frequent refresher trainings, especially with the use of data platforms like MWater. Make sure people know how to use that really well. Joint monitoring, and then how do we really adapt and contextualize at a local level versus keep things consistent enough where we can roll them up to a national Rwanda level. And then also, like I showed on that first Power BI dashboard, a global World Vision WASH reach dashboard, right? So holding the tension between local contextualization and general enough to roll up is kind of our constant challenge in what we do. So that is just the key achievements I wanted to share. So maybe just a few questions for Leonce and Maybin, and then we'll turn it over to all of you to ask anything. I'll also throw in the chat right now, we did create a story map that walks through the story of Rwanda and even does a better job of showcasing how we use data, how you can zoom into specific water systems. And so don't get too lost in that now as we talk, but do take a look at that later today. It's a nice piece just to bring through all of our thinking there. So maybe I can start with you, Leonce, here. You mentioned this already a little bit, but how did you think about partnership with the government? And, be honest, what were the challenges and what were the successes there?
Thank you so much, Peter, for the presentation and for the question. So at the beginning, it was difficult to partner with district, mostly because their approach is a district approach in implementing universal water basic access. But World Vision is not covering an entire district; it's working only in its subsectors. So, but with MWater at the beginning, it has been very easy to convince the government because it was easy to see what community has been connected and what community is remaining to connect. And it's also easy to start planning for finally a district-wide approach. So MWater has been very important in doing joint planning with the government and also in deciding the partnership, because it shows that from a sub-district approach you can reach the district approach. So from there, we planned each year to get together. We could plan for the remaining communities each year and also sign MOUs, co-financing MOUs, where we would have the World Vision responsibilities and the district responsibilities to implement water projects to connect communities that do not have basic water access. Thank you, Peter.
And that negotiation with the government to determine roles and responsibilities, how long did that take?
At the beginning, it took really long, like I think almost a year. So the activities were really slow at that moment. So, but when everyone was now on board, then the activities really took off and we could implement a lot of projects per year where we could even do 20 water supply system. And this means really big water pipelines with almost 100 pipelines per each water supply system. So I would say that after 1 year, the project really took off and the implementation was really good and supported by everyone, being World Vision, being the government, and also other stakeholders.
Yeah, I will say on the kind of the fundraising side of things, we did launch this project and we're all excited about this project, and then initial progress was relatively slow because of government negotiations, right? So on the one hand, that was a challenge to the start of the project, but we never would have achieved what we did had we not taken that slower start. So overall, really good and helpful. Just, got to manage the different stakeholders is all. Maybin, you have an interesting view in that, after it was clear that work in Rwanda was going really well, World Vision made the strategic choice to maybe try to do this in other areas too. And so the next area was Zambia, where you were the WASH manager before taking your current role. And so I guess, what learnings do you think Zambia and World Vision more generally took from the Rwanda team, and what were those key aspects of success that you were able to build into the Zambia project?
Yeah, I think the case of Rwanda gave us a lot of confidence in terms of reaching universal service coverage for water supply in Zambia. We could see that within World Vision Rwanda and also the government, the commitment was there. And those are some of the lessons that we took for our scaling up program in Zambia. And most of the key interventions which were done in Rwanda. So, for example, beginning with the baselining to understand at what stage you are in terms of the water coverage in each of the districts that we were intervening was very important for us. And that gave us, in terms of how many people are we supposed to service, how much investment do we need to put in, and how much of that do we need to ask the government for their commitment for them to be able to support. I think that really helped us a lot in terms of building our case in terms of universal service coverage in Zambia. And it made, I think, our work a little bit easier, and thanks to Leonce and the team here in Rwanda, because they did an incredible job. And for us, it was just to walk the path which they had already walked in. So that really made our work easy to do. Yeah.
Yeah, the Zambia team definitely did a lot more intensive data collection and mapping of water points before they started in MWater. We, in Rwanda, we started with a different system and then transitioned to MWater halfway through.
Yeah.
So it was a lot of work for your team to do all of that data collection, but I think it's put you in a really good spot now for tracking and seeing progress. Leonce, maybe back to you. Can you speak about what measures of sustainability we've put in place, right? I think, one of the things about World Vision is that even if we have a specific 5-year project or something, our area program model has us in a community for about 15 years. And so we are, with people for much longer than the normal tenure of a development project. So that's helpful, I think. But what else are we doing other than just being there in the community? What have we put in place for the sustainability of this infrastructure that we've built over the last 5 years?
Thank you so much, Peter. So first of all, as we already the government on board, and we also have the water and sanitation utility on board. So we work together on a daily basis, from the design to the construction and to the operation and maintenance of the water supply system. But we also do have water user committees. Whenever we have completed a water supply system, we also establish water user committees for them to be able to overlook the water supply system and be able to raise the voice whenever there is an issue with water supply. And so we also did some training of private operators. So the water and sanitation utility is not, at that time, it was not covering the entire country in terms of operating and maintaining water supply systems. So at some point, it was obvious that private operators were not able or capacitated to operate big water supply systems as they should be. So World Vision did some advocacy work at the high level, at the national level, and it ended up by amending the policy of rural water supply system management, where it was moved from district hands, because district did not really have technical expertise in managing and operating water supply system, and it was really a concern for them and for the community. So for these advocates work, the government has handed over the operation and maintenance work from district to the water and sanitation utility, which was at that time operating only in urban areas. So I would say that this is really a milestone that we are celebrating, because now water supply systems are in professional hands, and they know how to operate and how to maintain. But we are still advocating for government to strategically plan for funding to maintain and operate water supply system, because only tariffs cannot do that. The other thing I would say is also that, as you said, we remain in communities for 15 years. So we have continuous program in capacitating the community, and also WASH practitioners to continue improving and developing and innovating to sustain this infrastructure. Thank you.
Great. I will say, the sector is thinking more and more about that financing challenge, about how, more urban systems have more payers into the water system and therefore are more sustainable, where more rural systems, where World Vision traditionally works, sometimes does not make financial sense for a private operator to operate the system if there's not enough users. So we're continually having that question and battle. I agree with you on what's the tariff and who can pay and what's the government subsidy and all of that. It's not easy. Maybe last question to you, and then we'll open it up to the chat box here. Thinking about moving from Rwanda to other countries, Rwanda had some specific advantages in that it's a smaller country. People live in a bit more dense settlements. We found in moving to Honduras, which is our third country that's kind of doing this, finish the job effort, that one of the challenges there on the data side is that where Rwanda is mostly community water points, Honduras is mostly household water points. So just the amount of mapping that needs to happen is a lot different if you're thinking about, 100 households. That might have been one community water point before, and how do we do that? So I know Zambia has had its own challenges. We talked about the, key data collection effort as you started, but what have been the challenges in Zambia as we actually try to reach universal coverage in the areas where we've been working?
Yeah, thank you so much. I think one of the major challenge, for example, in the case of Zambia, is that you would find that the population is very sparsely located. It's difficult to find people like in one location, like in the case of Rwanda, for example. It was very easy to reach the people because we were able to, for Rwanda, it was easy to reach the people because the people are in one place, and because of that, it was easy. But for Zambia, people are located in different places, and that means that the investment becomes a little bit expensive for us to do. And even the mapping, because for you to reach each and every water point, you need quite a lot of resources for you to be able to do that. And that's one of the major challenges that we had. And also the other part to that is that at the beginning, we didn't have much support in terms of the government as compared to Rwanda. I know for Rwanda, it only took 1 year for the government to come on board. For Zambia, it took a little bit longer for us to do that, to get the government on board. And I think it was like after 3 years when they started seeing the investment that we are putting, then they were like, oh, I think World Vision is doing something that we can really join hands with and be able to deliver with them. And because of that, we saw that water utility companies started coming to World Vision with funding, say, from World Bank, different African Development Bank funding, and then say, okay, World Vision, can we partner together for us to be able to reach this kind of number of people? And that at least lessened most of the challenges that we were facing working with the utility companies to come on board and be able to deliver on those particular programs. So I think this is what I can try to share, I think, in the case of Zambia.
Excellent. Great. Well, I think we've got about 20 minutes left here, so I want to be sure we do get to the comments in the chat. So I'll start there with the comments that are there. Please feel free to throw more questions in there in the chat. I think there's a raise hand function here. If folks want to come off mute and say something, we can do that as well. So I'll start on the top here in the chat. Is the MWater dashboard utilized primarily by World Vision, or do government stakeholders engage with the dashboard and data? I would say at the current moment, it is largely an internal tool, although we do have public-facing parts of the dashboard and the ability to create specific dashboards for a government, a partner, that kind of thing. It does take quite a bit of behavior change for a full systems change and where we go to look for data and all of that. And so our focus right now is being sure that everybody at a national office level, from Leonce's level as the WASH manager down to maybe a development facilitator in an area program, all can have access and see and utilize the data that, you know, regional leaders and leadership at World Vision can see and access and know how to utilize the data. So that's our current challenge. But absolutely, the hope with MWater being a public platform, we don't want anybody collecting data multiple times. If we've already collected the data, we don't want the government to have to go out and collect data on water points and water systems. The government of Malawi actually is using MWater as their key data collection platform. So they were before us, even at World Vision. So we hope more and more governments will come on to there. Maybin, from your regional viewpoint, anything else to add to that?
Yeah, I can also confirm, I think government of Zambia as well, they are using MWater. We support from UNICEF. I think we've also seen in Uganda, for example, where we've seen a number of partners coming in also to support in terms of the use of the MWater too. So I think, which is incredible, because the MWater is not just for World Vision, but other partners and governments can also utilize using their various resources. But data can be shared with the government, especially for decision making, which is very important. Great.
Leonce, I'm coming to you next. The question is that the title of this talk includes the term vulnerable communities. Does this include historically marginalized communities in Rwanda? And if so, in which districts? So how has been your take on reaching the most vulnerable in Rwanda?
Thank you. So when we say vulnerable communities, mostly we mean the poorest communities where World Vision is working. So these are selected based on different indicators, mainly poverty indicators. Some of them there are the level of access to water and sanitation, to education, to health and nutrition, to development in general. So those are the communities that World Vision is serving. And this project was implemented in 39 sub-districts. So those are distributed in 15 districts of Rwanda. So some of them are namely Karongi, Gicumbi, Gisagara, Huye. So there are 15 of them, and I think those data are available on MWater dashboard. Anyone can visit them and see what the names of the sub-district and also the names of district covered. Thank you.
Great. And how, just for those who are not as familiar with the Rwandan context, the government does classify individuals in different levels of need. Is that correct?
Actually, this is part of the social protection policy. So the community would sit together to identify their members who are in most need of everything. So most of those people, those selected people, are subsidized in health, in water, in everything mostly. But also depending on in classification of sectors or district, this is done by the government itself. So data are available on the level of development of each sector or each district. So when World Vision is going to open an area program, World Vision discuss with the local government to identify the district, or I mean the sectors or sub-districts that are most in need and of most World Vision programs. So I think Peter mentioned them at the beginning of this workshop. Those are we have programs in health and nutrition, we have programs in water and sanitation, in education, in livelihood. So World Vision together with government identify those sub-districts, and that's where World Vision will implement its program for 10 to 15 years.
Great. There's a question on, were any decisions easier to make after moving to MWater and GIS than previous data collection and analysis methods? So did moving to the MWater platform help us make decisions? Leonce, you're nodding your head yes. I'll start with you and then we can go to Maybin.
Absolutely. Yeah, actually, I think data quality and data storage was already a problem with the previous methods. So with MWater, it's easy, and I would say it's our favorite tool in deciding where to construct a water supply system, to also monitor activities in WASH. Activities that are being conducted in real time, because you can create surveys, and it's not only in water, it's also in sanitation, in behavior change. You can create a survey and monitor the activities that are being conducted in a given area. So I would say that definitely water is really helping us in monitoring in general our WASH program.
Yeah, I think it's basically a one-stop shop for us as World Vision, because the whole data reporting, analysis, and everything, I think, is very clear for us. And the beauty is that it's not only World Vision that is utilizing the platform. We have many governments that are using. So as World Vision, we're in 42 countries, and we know that most of those particular countries, they are utilizing this particular platform because it's an open source platform and it's user friendly. You can collect your data offline. You don't need any internet data for you to download any particular survey that you would want to conduct. It's very easy to utilize. I think we've been able to train not only our World Vision staff and even some of the volunteers, they're able to utilize the application, which is very user-friendly, I think, which has really made our work very easy. And you know that World Vision, we work very closely with volunteers in the communities where we are. We are found in most of the remotest places in each of the countries where you go to, where many people cannot, even other organizations have been unable to go there. That's where you find World Vision is operating, and having such a tool with our volunteers utilizing, with the Android mobile phone to collect the data, I think is really made us our work very easy for us to be able to do.
Yeah. I'll say too, unfortunately, Excel sheets is sometimes where data goes to die. People put information on Excel and then it's hard to access it or see where it is. And even from the rolled up level, right, sitting in the US, I might see that in Rwanda, they reached 70,000 people last year. But if someone comes to me and says, did we work in this specific area? Someone knows that information. It might not be top of head for me, but if we have data in MWater that is geolocated, I actually don't have to ask anybody else. I just pull it up and say, yes, we have this water system that was created last year in this area, and that helps us to make those decisions on where to put more effort into, where to work more, and just have a better sense of what we're doing. Well, I'll pause for a second in case there are other questions out there. Feel free to raise your hand or throw it in the chat. And if not, we can go to the story map real quick to walk through that. So any other questions?
Yeah, I think there is one in the chat.
Oh, Yes, there is. Sorry, I missed that. How do you balance amount of data collected with amount of data you can actually use? Great question. It is hard to get the balance right because we'd like information on a lot of things, but there is a human personnel cost on actually collecting all of that data. And then thinking about protecting that data is another question altogether, right? And so I think we're currently wrestling with that internally about how much do we need actual, so for instance, currently, if we build a water system, we have people break down the number of people reached by gender and age category. So it's boys and girls 0 to 5, boys and girls 5 to 18, and then men and women above age 18, right? That's 6 different categories to break down one number towards. That it's helpful to have that breakdown, but do we need that level of detail? I think where we're probably moving is building in some automatic disaggregations into our survey so that we take the, census data of either the country or the district where that data was taken and break up the people reported by those categories that are published by the district. That will hopefully reduce the burden on data collectors, reduce the size of a survey and the time it takes to refresh the survey once you are online. And so, yeah, it's a difficult question that we have a push and a pull on. Even we'll launch a survey and then often national office teams will say, this is great, but we also have other things that we're interested in and we want to collect. The survey is malleable enough where they can add other questions that they want answered. However, our caution is always just be careful. Don't be collecting data that you're not going to be using because it gets really heavy.
Yeah, just to add one point, Peter, I think the other thing is that in terms of balancing the data, we've focused, of course, more on water supply at the moment, and we're trying to see how we can build probably to sanitation and hygiene, and how much of that data can we be able to correct, and the resources also required. I think is one area that we're still trying to build on. Very, very important, I think, question that you've posed. Thank you.
Excellent. So real quick, I'll drop the story map link into the chat one more time, and I'll share my screen here. So this is what we'd love for you all just to scroll through when you've got time. This is an ArcGIS story map that just brings us through a lot of the information we talked about today. And so again, you'll see these ingredients for success is what I presented in the slides in a much more brief format, but you can look at all of the details here. And then, this is really where the data-driven programming comes in, right? And so we can see all of the individual water points that have been created in this system. I can click on a water point and see specific information about that water point, right? We can zoom in specifically to the treatment facility, which is here, and here's a picture of the treatment facility. We can head over to the main storage tank over here and see what that looks like. And then we can we pulled a picture here. We do have pictures for all the water points. We did take them off of this just for privacy reasons, but we did get permission for this photo here from those that were in it and put it as a representative picture for the different water points. And so I think it's helpful. Again, you can see over time, right, originally where all of our water points were, and then overlaying the population data and the 500-meter buffer I was talking about, you can approximate where we still have to do work, right? So by looking at this map, clearly this area here stands out as an area which we don't have data showing that it's covered by water. So either that means this is an area we should prioritize for additional work, to that question earlier, or maybe there is a water system here that we just haven't mapped. And so even by having this data, we can have the conversation internally and with the government on, is this really a missed area, or do we just not have the data and we have to go collect the data? That's a key question for us. And so even here, as you scroll further down, we have a specific look at Kigoma subdistrict as it comes into visualization here. And so these are all of the 39 subdistricts in which we worked in for Rwanda and the year that we were able to finish work in that subdistrict. For Kigoma specifically, if you zoom in, you can see all of the roads and all of the polygons that represent a structure, which are households. This is mapped in from Geo for Good data, right? This population data, and then we can pipe in all of the public water points that have been created, either that World Vision put in or that were there before we arrived that were functional. And then we can do the 500-meter buffer, and we can even think through the household survey as well. So it's just a fun illustration of all of those water points being a nice point of light and lighting up the district there. So do take some time, look through that, right? This animation on the left-hand side here will run as I'm talking, just kind of bringing us through a 3D representation of the community. Not all of us can be in every location. Leonce has been to many of these locations, but I have not. So being able to kind of walk through it in a 3D way helps us to think through, okay, can I really imagine walking to that water point, and would it be under 30 minutes to actually go and collect water from this water point? And so as we zoom in on this water point, that's just a picture that we took at this specific water point. If you zoom in on that plaque, you'll see all the information, has the government logo, has World Vision's logo, has the Water Authority's logo on there. And there's the government memo we got sign off for. So all of that is great. You can even go and look at more information here on the MWater dashboard. This has some of the key information about all of the sectors in Rwanda, and you can look at that in more detail. So I guess I'll just leave here with saying, I went a smidge too far. Even though we did do a ton of great work in Rwanda, 39 sub-districts, that does not mean Rwanda as a country is fully reached with water access. All of these orange areas on the map now are areas that since we started in 2018, 2019, these are all areas that World Vision Rwanda has opened new areas of operation in, are continuing to work in. So we are still doing water sanitation and hygiene work in Rwanda, just outside largely of the 39 districts that we've already claimed universal coverage there. So I will stop sharing there. We're almost at time. Maybin or Leonce, any final word before we pass it back over to the organizers here?
Yeah, thank you so much, Peter. I think it's been an incredible time together. And as World Vision, we are committed to partnership, collaboration, working with the government in each of the countries where we are, and ensuring that we're able to show evidence, because this is very important. How do we show evidence in terms of our work? And if we do not have proper tools or proper data management tools for us to be able to show that evidence in terms of what we are doing, it becomes very difficult to convince the government with the advocacy for them to be able to support in terms of the work that we are doing, to give that commitment that we need in each of the countries where we are. So it becomes very critical for us to really strengthen our data management tools and how we can be able to show that evidence for us to be able to continue to do the work that we are doing. So thank you, Peter. Over.
Thank you so much, Peter. I just want to say that this journey of implementing universal coverage in these 9 sub-districts was really good and informative for all of us. being the government and other stakeholders. And it couldn't have been possible without partnership, as Maybin said. So it's clear that without partnering with government and other stakeholders for strategic, financial, and technical support, it wouldn't have been possible to reach these within 5 years. So partnership is a key to this milestone. And I can also say that the staff who worked on these projects were really capacitated, because they saw how from the beginning, from the baseline, from the mapping to the technical side itself of constructing water supply system. It capacitated everyone, and we are really grateful for having been able to participate to this important project.
Great.
Thank you.
Well, thanks all for joining us. I know we're a minute into your next session, so in your Whova app, you can see the next session and log in there. Thank you all for joining us. We hope you have a great rest of your day, and we'll hopefully stay in touch.